This is chapter 34, the school-age child and family. Here's your list of objectives. You can print this off and follow along, check them off as we go through the chapter. Promoting optimal growth and development. Facial changes become apparent in bones in the legs lengthen, causing growing pains in some children, mostly in boys. Some 10-year-olds still look very young while others look very mature. Nurses must be cautious not to treat one different from the other just because of the way they look at this age. And school age generally is defined as ages 6 through 12. It's a gradual growth and development during this stage. Middle childhood, height increases by 2 inches per year. The total height is gained in 1 to 2 feet. So you see them 1 week and then you don't see them again for a couple weeks if they're your grandchild, and it seems like they've just grown tremendously overnight. Then weight increases 2 to 3 kilograms per year. That's not a lot. Weight almost doubles. Boys and girls differ little in size during school age. Physical changes, movements are more graceful than those of the preschoolers. Skeletal lengthening and fat diminution. School-age children don't have a lot of fat. That's a little bit older than that. When they get into pre-puberty, they start to put on a few extra little pudgy pounds. There's increase in muscle tone, decrease in head circumference related to height, and a change in the facial proportions. It's the age of loose teeth. As you can see here, this young lady is missing some teeth. Middle childhood, the deciduous teeth are shed and the permanent teeth come in. Maturation of systems, the bladder capacity increases, the heart is smaller in relation to the rest of the body. The immune system should be increasingly effective. They're older now, they've been exposed to a few more things. Bones continue to ossify, and physical maturity is not necessarily correlated with emotional and social maturity. It just depends on the child. Prepubescence is the pre-adolescence period of 2 years before age 13. I think that would be about 11. Prepubescence typically occurs during pre-adolescence, and the age of prepubescence varies from 9 to 12 for girls, which is about 2 years earlier than boys. Puberty begins at approximately age 10 in girls and age 12 in boys. Puberty signals the beginning of the development of secondary sex characteristics. Like in young ladies, the breast buds will develop about 1 year before they start their period. In Erikson's stages, it's a sense of industry, stage of accomplishment, eagerness to develop skills and participate in meaningful and socially useful work. It's an acquisition of sense of personal and interpersonal competence. There's a growing sense of independence, and the peer approval is very strong in their lives as a motivator for them to do certain things. The sense of inferiority, children need and want to feel useful and be able to achieve whatever they endeavor to try. And we must encourage them and not overtask them with things that we know are beyond their reach. Take into consideration the mental and physical ability of the child and let them explore their capacity to accomplish and achieve as they reach to master skills that they never tried before. So all children feel some degree of inferiority regarding skills that they can't master. So we need to encourage them. These are school-age children that are motivated to complete tasks. These children also have a concrete development according to Piaget. They begin to make judgments on what they think as well as what they see. And they learn to tell time and can see the relationship of events in history and space. They use constructivism to build on what they have already learned. That may be also referred to as scaffolding. They can use classification skills and order objects and become more organized. This picture's in your book on 939. It's about common examples of a child's ability to conserve. Kohlberg, your moral development theorist, says that this age may interpret accidents and misfortune as punishment for bad things they did. Older school-age children understand that rules and judgments become less absolute and authoritarian and pay more attention to the needs and desires of others. Spiritual development is the children of this age expect to be punished for bad behavior and will help you figure out the punishment to meet the crime. That's helpful of them. Children think in very concrete terms. They're avid learners and desire to know their God, whatever they've been brought up to believe. Children expect the punishment for misbehavior, and children may view illness or injury as punishment for real or imagined misdeeds. Social development, peer groups have a culture of their own. They're very important to the child, gaining some independence from the parents. They form intimate relationships in the form of BFFs, best friends forever, and they often argue, persuade, bargain, cooperate, and compromise with each other. And they're learning how to get along with people in general. School-age children enjoy engaging in activities with their best friends. Conformity is the core of group structure. This age loves to join groups and help make rules for everyone to follow. The relationships with families, parents are primary influence in shaping the child's personality, behavior, and value systems. Increasing independence from the parents is the primary goal of middle childhood. And parents need to be the adults, not the friends at this age. Play, rules and rituals, team play, quiet games and activities. I believe you have an assignment on Canvas entitled Play that I would like for you to watch. School-age children take pride in learning new things. So here she's learning to play the piano. This is the age where birthmarks or anything that's not like everyone else has in their circle of friends becomes a serious issue with their appearance. Conscious awareness of self-perceptions and relatively accurate and positive perception of their body image unless they have something wrong physically. School experience. This is a time when the parents are the ones that make the difference in how well the child adjusts to transitioning when they go to school. If the parent is clinging to the child and refuses to let them have friends and participate then with the child, they'll certainly have trouble adjusting to being outside of the home. So it has to do a lot with how the parents adjust to the child going to school. Children need to have a teacher who's warm and loving, perhaps like their parents. Teachers need to be as concerned about the child's psychological and emotional welfare as they are in their learning. Parents can supplement school programs by participating and being responsible and helping their child with their homework or projects and staying in touch with the teacher. Latchkey children are those who need to come home to an empty house and stay by themselves for a little while until the parent can get home. Children will lie on occasion, especially the younger ones. Older children may lie to fit in, and cheating is common in children ages 5 through 8. Most children do not take responsibility for these behaviors until they're like in middle school. Nutrition, importance of a balanced diet to promote growth, very, very important. Quality of diet related to the family's pattern of eating, so the child is brought up to eat whatever the family eats. Developing a taste for a variety of foods depends on how experimental the family is. Fast food concerns, of course, we all eat too much fast food. and it's very convenient for the parent who works late to bring home some McDonald's to their child out of guilt, if nothing else. And then there's the My Plate that tells you how we're supposed to eat nutritiously. Sleep and rest. Sleep averages 9 to 11 hours a night during school age, but it's highly individualized. Children may resist going to bed at ages like from 8 to 11, and children aged 12 and up are generally less resistant to going to bed. Sports. Controversy regarding early participation in competitive sports. Concerns with physical and emotional maturity in a competitive environment. They're really cute out there in their little football and soccer outfits when they're 3 years old, but they get kind of rough, some of the bigger ones with the little ones, and it may be an emotional downside for the little ones. So I think you have to know your child really well and not push them too early. Acquisition of skills. The children generally like competition, but not so much that they're forced into doing something they don't really want to do. Children age 8 to 10 spend at least 8 hours a day on media of one form or another, and teenagers spend at least 11 hours a day looking at something, whether it's their phone, their iPad, their computer, TV, or whatever. Parents need to set limits and monitor what their children are watching and know who is communicating with your child online. Bullying and too much violence, all those YouTube videos they like to watch on death and all kinds of crazy stuff. You don't know what that's doing to your child's mind, so you really need to monitor that. Dental care is always important. Dental avulsion, replacement, reattachment. Of course, we know that if a tooth gets knocked out, we're going to place it in some cold milk and take the child immediately to the dentist and see if they can actually reimplant it. Sex education. Sex play is part of normal curiosity during preadolescence. Peers versus parents for primary source of information. First, when you're going to talk to your children about sex education, you need to find out what they already know. You might be surprised. Middle childhood is ideal time for formal sex education, and we use the lifespan approach. Be honest with them and tell them the truth about the sperm and the egg and how things get fertilized and a baby is formed and so on. Information on sexual maturity and reproduction is important, and effective communication with the parents. Always give your child that open door to talk to you about anything. Treating sex as a normal part of growth and development is important. Questions and answers always be available. Sexuality is about your sexual feelings or their sexual feelings and thoughts, their attractions and behaviors towards other people. You can find other people physically, sexually, or emotionally attractive, and all of those things are part of your sexuality. The nurse can provide information to the parents and the children about human sexuality, and questions should be answered honestly and on the human growth and development spectrum. Exercises on clarifying values, identifying role models, and engaging in problem-solving skills, practicing responsibility, are important to prepare children for early adolescence and puberty. Responsibilities of the parents, schools, and health departments. Did you know that in Florida, in the county health departments, they will see a teenager without the parent or without even the parent's permission and give them birth control pills, test them for STDs or STIs, and not have to notify the parents, and they don't charge them for this. It's very important, I'm glad I don't have any children to raise nowadays, that you keep that door open for them to feel like they can talk to you about anything. You're paying for insurance for these children to be taken care of, and they go behind your back to the health department to do something behind your back. You need to take care of that. That's a household thing for parents and the children. Make sure you know what your child is doing. Injury prevention. Most accidents occur near home or school. The most common cause of severe injury and death in school-age children is motor vehicle crashes, whether it has to do with being hit by a car or being a passenger in a car. Bicycle injuries can be mostly prevented with bicycle helmets. Important that we teach them from the time they learn to ride and participate in any kind of activity like skateboarding and bicycling, that they have the safety equipment that they need for whatever sport they're participating in. The right size bike is very important. The child should be able to sit on the seat and place the balls of both feet on the ground, and always wear their helmet. See the Family-Centered Care box for guidance during the school years on page 952. Now we're moving to infections of the skin. Table 34.3 on page 953 talks about bacterial infections. Most of the communicable diseases of childhood are associated with rashes of some sort, and each rash has its own characteristic. Common viral disorders of the skin are on 954 and table 34.4. A lot of them are associated with rashes also. On page 955, table 34.5 is a list of fungal infections. Then we talk about scabies. It's an endemic infestation caused by the scabies mite. Lesions are created as the impregnated female mite burrows into the epidermis, where she deposits her eggs and lives in the tissue. It's like little tunneling in the skin. This is passed by close personal contact and treated with a scabicide drug, and you can see this on page 953. Pediculosis capitis is better known as head lice. It has no respect for age, socioeconomic status, or cleanliness. Very easy to pass from one person to another, and all things that may have been in contact with a child who has head lice, like scarves, towels, pillowcases, sheets, clothing, needs to be washed, and the child needs to be treated, and the adult, with Nix or some other product that will kill lice, and then comb through the hair very well to remove the nits and the active lice. Then you want to treat them again within 7 to 10 days, and I'm sitting here scratching my head right now. So now as we're talking about this, I'm sure you probably all like scratching. Moving on. ADHD and learning disabilities, attention deficit hyperactivity disorder, refers to developmentally inappropriate degrees of inattention, impulsiveness, and hyperactivity. This behavior elicits a negative response from others and causes an adverse effect on the child's self-concept. This needs to be managed through a lot of different sources, possibly behavioral therapy, meds, environmental manipulation, and it's an interprofessional care management program. Post-traumatic stress disorder can be seen on page 958, and that also covers the next two slides. Childhood depression, therapeutic management, interprofessional care management. That's care management. I didn't make this slide, not car management. Childhood schizophrenia, interprofessional management of schizophrenia. Childhood schizophrenia is not that common, but it does happen. Most children would have to be institutionalized for a while till they can get their pain, their medication management under control. And your question says, don't even need to read this, everybody knows the answer is cold milk when a child's tooth gets knocked out. And that concludes this PowerPoint. Thank you.